This X this out. We're recording. This out. Put this down, and then make this. Okay. So it is a short chapter compared to the other ones. Um, but again, as I said, like the reason I started with chapter 21 at the beginning, because they have the anatomical landmarks, and then we can practice on these almost every time we do a lecture. So hopefully that will be helpful. And today we'll talk about the image orientation and introduction to interpretation. Technically, this is before chapter 21, right? But again, we start with chapter 21. So we're going to talk about technically mounting the x-rays. And it's good that you guys have already been there and kind of started doing that. So you guys are going to relate to what we're talking about. We'll just go to get to know a few other things here and there. But again, it's a short chapter. So we have technically two terms when we talk about organizing the x-rays for viewing. When we want to view the x-rays, what do we call it? Do we call it mounting when we actually put the x-rays and radiographs into place, or we call it orientation? So as you know, we used to have the films, which are the actual physical films that we take x-rays with, and we have to process through the machines, and then we can see the picture, and an actual film that you hold with your hand, right? And that we mount on these kind of mounts, right? These mounts that we used to have. So this is called definitely a film. And then we have the digital ones nowadays that all offices must probably use, and most probably never going to work with film anymore. And the digital, we call it like an image. So the physical film, we call it a film. The actual digital one, we call it an image instead of a film, like the terms. So for films that, again, most probably not going to see or use much, we call it film mounting, and we call these things that we put the films in, we call them film mounts. Most probably you've seen them in the lab. And then we used to view them in a device that looks like this, and this is called a view box. Technically, it's a light in a box, and it illuminates, and you put the X-rays on so you can see better. So that is called a view box, and that's what we used to do with. My sound is coming back to me, so someone have their mic on. Uh, That's what we used to do with the regular films, again, that most probably we're not doing anymore. But just know the terminology. So for films, we call them mounting and film mounts, and we view them in a view box. For digital ones, we call it image orientation more. And instead of a film mount, we call it an image template. And this is technically the template. That's what you see on the computer, right? That's the template, right? Again, it's just the terminology that we have that is different. So we definitely view it on a computer monitor. Okay, we got that out of the way. Now, again, here talking about the film-based mounting. So when we were using the films, how we used to have two ways of mounting the film. So I'm not sure if you guys seen the actual, film in the lab. Did Dr. Spina show that to you? Like the old paper film, right? Yes, some of you maybe. The old films have this dot on it, right? It's a raised dot on the actual film that we use to help us with mounting and orienting the X-ray. So we know technically kind of the left from the right. If you keep the dot always facing specific direction, it can help you with that. Even now, you guys haven't worked with phosphorus plates yet, right? Just with the sensor. Yeah, the phosphorus plates also have a dot in there, which is technically a letter. And the letter would or the dot will help you with mounting them, organizing them correctly, because you would always, for example, put the dot on the bottom, on the X-ray when you take it. And if you move from right to left, always which is your right from your left by always putting the dot on the bottom of the film. Does that make any sense? No. Okay. So we are taking an X-ray and we have the dot here, right? And then I move around and then take X-ray here and the dot's still here, right? And then move to the, so this is the right of the patient, for example, and this is the left, and move and still have the dot here. So when I am mounting, so for example, I have an X-ray from here, an X-ray from the right, and X-ray from the left, and they're just mixed up. And I want to know which one is the right, which one is the left. Okay? So I say, okay, I place the dot always in the bottom. So let me place the dot in the bottom. And when you place it in the bottom, you'll know, well, if it was all the way to the end where the third molar is, that's a right one. And if it was here where the premolars are, for example, this is the left one. So the location of the dot will help you to correctly orient it left or right.
So you would still put it either like this or this?
No, it's always facing you, but you can either put it up or down.
Right.
So you have something, you know, you have a mark on a film that you always put, you know, we have this dot on the film, for example, right? And then we want to always keep it on top because I can't put it on the bottom, right? So if I kept it always on top and I took X-rays and then I took these X-rays out, I can just put it back on top, right? After I process them and all of these films in my hand. I say, let me just put it on top first, and then I can know, okay, this is my left and this is my right. So it's always, for example, the X-ray is always to the, again, the top, and I know when I'm doing my maxillary ones, they're on, on my right side, they'll be by the third molar, while on the left side, they'll be by the premolar and the penile.
So you can see the dot on the X-ray.
You can see the dot on the X-ray. Well, the X-ray, the film ones, you can feel it with your finger, and the phosphorus place, you'll see it as a letter on the X-ray also. It just helps you with that orientation way, okay? So again, this was mainly here we're talking about when we are trying to put these films in the mount. So since these are, the films are clear films, right? Like you see in this picture, I can see it from the front and I can go back on the back and see the film, correct? It's a clear film. So I can look at it like this. And if I look at it like this, let me stand here. If I look at it like this, my left is the patient right, and my right is the patient left, correct? But I can do this, and now I'm inside of the patient head, right? My right is their right, and my left is, okay? So that was used to be done with this type of film because it's translucent, and you can just hold it that way, or hold it the other way, technically, and read it. Does that make sense?
Yes.
So that's the mounting thing that is lingual and buccal, which again, you're never going to do that anymore, but just to understand the concept of left and of lingual, see here what do we have? Lingual mounting and labial mounting. So lingual mounting, you're looking from inside of the patient, right? And the labial mounting, which we now all do with our digital, you're looking from the outside. So your right is the patient left, and your left is the patient right. Okay? Again, just the way that you technically put the films inside of the film mount and the way that you look at them. So if you look at them from inside, that's a lingual mounting. If you're looking at them from the outside, that's a labial mounting. Is that clear? Okay, again, you're never going to do lingual mounting because most probably you're not going to see any of these X-rays anymore. It's all gone digital, but that's the way it used to be. And it's always the labial mounting is the one that is most used, and we use it definitely for digital as well. And it's looking from outside the patient mouth, and it's the one recommended by the ADA. Okay? So the method that we actually use now is the labial mounting, even for digital. Make sense? Again, so these are some types of film mounts. Again, these must probably you see or not. This is the most used one nowadays. If you see any, it's just a clear plastic, containers that you can cut at any location. So if you took only 4 X-rays, you can cut it and use it. Or if you took more, you can just get more and more of it. Again, nowadays, because it's all digital, you will not see much of these film mounts out there. We do have them in the lab again. If you want to see them, you can see them. But these are the older types. Now, for digital X-ray. So we talked about the film. We're now talking about the digital image, right? Because we call it an image. And instead of mounting, we call it what? Orientation. Okay, so digital, we call it orientation. Film, we call it mounting. Okay. An image template is the digital equivalent of the film mount, right? Of the film mount. So the things that you see here, these are the film mounts, right? But with digital, we have the computer, right, on the monitor, and that's called a template. Instead of mount, we call it a template. It's just the way that we call it for digital and for regular film. So some software where actually you put the films in, it will just do the orientation for you automatically. So it will mount it automatically. I mean, nowadays with all this technology and AI and all of that, you should just do it on, put all the films in the computer and the computer just put it on for you, right? It can be done again in some software. They can, by recognizing the images, the software just will place them in the correct placement. You don't have to think and click on each one so you can mount it in the right position. Does that make sense? Okay. So in digital, we have direct orientation, which is mounting, or indirect orientation, which is mounting. So what do you think the way that we're doing it now? Like, what do you do in lab? Are you mounting or orienting the films directly as you're taking them? Yes, right? So what do you have to do before you take the image?
Pick which one on the computer.
Exactly. On the template, right? You go on the computer, you pick one that you're going to choose before even you take the x-ray, and then expose the x-ray. And it will right away appear there in that location. So this is called direct mounting. Okay, you're just directly mounting the film. If we're using a different method, and this method is done with what? With these things, which we call them sensors. Exactly. I put wired sensors just to kind of. So direct orientation is what we're doing in the lab now. Most of our work in the lab, because we're only working with sensors. And we select the window of the template, right? And then we do the exposure. The indirect orientation is done with the, what do we call these plates? Do you know what we call these plates? Right, phosphorus plates. We call them PSP plates. And that stands for photostimulable phosphorus, or phosphorus plates. This is another digital method, right? But it's indirect because we have to take x-rays on the patient, collect these x-rays, put them in a scanner, and then once we put them in the scanner, we have to orient them or mount them, right? Yes? So that's...
With the plates, sorry, you need one for each X-ray?
Exactly.
Okay.
Yeah, that's the problem with the plates. You have to have, if you're doing 12 exposures, you have to have 12 films. And that's why, again, a lot of offices are moving on to sensors, because you just need one sensor per room, or even you take it from one room to another and you take x-rays. And same thing with the nomad, you just have like one nomad or two nomads for all the office where you can just move through. Okay. And that is, again, that's the direct digital taking and indirect digital taking, because you can take it directly with the wired sensor, or you can take it indirectly with the phosphorus plates. We know that the phosphorus plates are good because they're thin and they can bend a little bit, but the problem with them is, again, you have to do it, in multiple steps. You have to take x-rays, put them in a scanner, and then do the orientation. While with the sensors, you can just take it right away and you go. Okay. We have the digital template. So again, guys, you're differentiating between things that we're talking about, right? Just to confirm, for film, we call it mount and film mount. For digital, we call it orientation and template. These are the film mounts, and these are the templates, or this is the template that we see on the computer. Okay, So we have general considerations when we are mounting the x-rays or organizing them, again, whether we're orienting them or whether we're mounting them, okay? Things that can help us when we're placing the x-rays in the correct position that they should be on the mount, on the film mount or on the film template. So these consideration, we kind of also talked about already in chapter 21, because we'll now be able to recognize the anatomical landmarks like the maxillary sinus, the nasal fossa, all of the different things that we can notice. And it can help us to know, well, this is a molar x-ray on the maxillary, and this is a premolar x-ray on the mandible, right? So other things that are more basic things. So incisors on the maxillary teeth have wider or short or narrower crowns. Narrower, no, wider on the maxillary. The incisors. They're bigger teeth, right? They're bigger than the mandible, compared to the mandible.
Yeah.
The mandibular central incisors are just too small, right? The maxillary ones are larger ones, and the roots are longer or shorter? Longer, right? So the incisors on the maxillary arch, so if you have two x-rays and you're not sure are these centrals on maxillary or on the mandible, you can know that the maxillary ones are larger in the crown and longer on the roots. The canines, we can differentiate them from the other teeth generally because they have the longest roots, right? Especially on the maxillary, it's really long, and then you can know this is the canine if you compare it to the other teeth next to it. Again, these are the clues that we use to know and identify what exposure we're taking now and where to place it in the film mount or the film template, right? Okay, molars on the maxillary arch have 3 roots, right? And we also see on the maxillary big radiolucencies like the nasal fossa and the maxillary sinus. These are other things that we see again to help us know that, well, this is the these are maxillary teeth. I think I put some pictures here just to kind of relate to. You can see this is a root canal done, and because sometimes the third roots would not really be clear much on the maxillary arch. Like you see here, this is a maxillary molar, and you cannot really tell much which one is the third root, but it's that one. That's the palatal root. It extends much longer. But again, if you see in this here, where we have an endodontically treated tooth, you can see we have 1, 2, and 3 roots, right, of the maxillary arch. Of the molars and the maxillary arch, definitely we have the maxillary sinus. What do we call this here? Maxillary tuberosity, right? The maxillary tuberosity. Let's see here. Which tooth is that? First premolar, right? On the maxillary arch. So a lot of times the first premolar, about 70% of the times, we would actually have 2 roots at the end like that. So again, it's not that much visible if you take it like a direct x-ray because it will superimpose itself and it's just a small furcation at the end. But again, I got these pictures because they're endodontically treated and we can actually see it, that it has 2 roots in there. Okay. And then definitely the radiolucency here. So what else do we have? That's for the maxillary arch with the mandibular teeth. The molars have how many roots? 2 roots. We already know that. And then the roots of the mandibular teeth curve distally a little bit more. The roots curve distally. And the body of the mandible have a curve, which we call the curve of Spee, right? No, I'm sorry. That's the other thing. But the body of the mandible generally curves. So if we look at a mandibular x-ray, you always see this curvature. And because that's the body of the mandible here. So you have that curve that goes up to the ramus. Okay. Again, these are a few things to notice other than the other all tons of things that we talked about in chapter 21. Okay. So you can see, I mean, one thing about this, definitely, I mean, not all of the digital ones will get correctly placed. So there's still some errors. We have to rotate, we have to mirror some of these x-rays or images. So there are a lot of different things that we can do. I mean, things can get wrong. We cannot rely on the softwares to make sure that, to automatically do it for us. Again, because these are stupid softwares. Yeah, I mean, like if you think if whichever, just a big tech company, you tell them, well, just solve this for us. They'll give you a software that can do it for you right away without even having to think about it. Well, next time you'll have just a robot that, goes with an arm. You can just take an x-ray for this and this and that, and just the robot goes around, take the x-rays for you, and that's it. Life is simple. That's what I'm going to invent later. NEMA LLC. I have a lot of ideas, but, well, no investors. Right. Okay, so blank is explaining what is observed in terms a patient can understand, and blank is identification of abnormal condition or disease. Interpretation, diagnosis. Yes. So two terms. Interpretation is just explaining, and this is for radiology, definitely. We're talking here. So interpretation can be done by us, the hygienist or the dentist. So we can take a look at the x-ray and just give general idea, information about what we're seeing to the patient. Well, see, like you're missing a tooth there. There's a cavity or a filling there that, your teeth have a well, no, we don't tell them radiolucency, but, you have a hole in the top, for example, which is like a preapical abscess. We tell them there's so that's interpretation, right? Everyone can do it, but we have definitely also to be cautious not to give any wrong information. Diagnosis, on the other hand, it can be only identified or done by the yes, right? So they're responsible for the final diagnosis. This is just a footnote. Although radiographs are said to be lose value after 6 months because the patient changes, oral condition change, but they still have a value because we can compare them to the other ones. So anyway, one thing to keep in mind again, like we don't want to diagnose, even if you know something, this too clear to you, can see it, this tooth needs a root canal treatment. You don't want to tell them, oh yeah, you're going to have a root canal treatment here, or we have to extract your tooth, right? So this is something to leave to the dentist, right? We want to do that. And even when, I was working as a dental assistant for a while, I have my degree, I've been in dental field, but I don't, go further that my lines. I have my duties as dental assistant, and I don't do any diagnosis as a dental assistant, even though I might know, or I know how it's done, right? So that is something to keep in mind. And I do want to mention another thing. So, I speak another language too. You know what language I speak? Huh?
Is it Russian?
Russian?
Oh.
Nine. No. Arabic. Arabic.
That's what I was gonna say.
Yeah, I'm from Iraq originally. So
I was like, oh wait, maybe.
no. So I speak Arabic, and when I worked in an office, we have another Arabic-speaking person that was in there. And one time we were speaking, in the office, and it was just at the beginning when I started. So like we're just talking in there, and the patient was there, and the dentist. So they gave us a note that it's better not to, to just get everyone involved in the conversation. So it's an important thing. And even if you're speaking in, a different language, you always want to explain to the other people. Like, for example, I'm in a patient here with a patient, I'm speaking with my friend, maybe, or the other dental assistant in Arabic. If that happened, I'll tell the patient, we're saying this and this and that. So it's an important thing to keep the everyone involved in the conversation, right? Because people might feel distant or excluded from the conversation. Huh? Yeah, talking about them. So let's make it a habit. Even in our labs, try your best to always, just speak in English with each other. I know sometimes it's easier to speak your language to explain some things better to each other. But again, just out of personal experience. Again, I speak a different language too, but just keep that in mind. It's a little bit more on a professional side to be more professional. It's always good to again, if you speak something, you can always tell the dentist what you're speaking or tell the patient. Definitely in your private conversations there, no one's going to pay attention, but in the lab, in the work, in the with the patient. Okay, moving on. So we have some rules, technically, well, not rules, recommendations when we want to view the FMS. As we always said, having a system to view things, to take X-rays, to anything. It's always good to have a system to make sure that you're not missing. You're not missing a diagnosis. You're not missing an X-ray. So this is our recommended sequence for viewing the FMS or FMX. And you can see, where are we starting with? Maxillary right posterior, exactly. And then we're moving clockwise to all the way. So we're reading this and that to all of the top raw, all the way to the maxillary left posterior here. And then where we're dropping down to mandibular left posterior, just like when we do the teeth numbering, correct? And then all the way to the mandibular right posterior. We have few more X-rays that we haven't read, which are bite wings, exactly. We have to do the bite wings from right to left. Again, this is a recommended sequence of viewing X-rays. So it's always good to it's good to follow. Again, if you want to read the X-rays, to follow that. But again, you're not going to take FMSs every day. Most probably just going to take 6 X-rays or bite wings and PAs. So it's not an everyday thing, but again, it's a sequence. And hopefully you understood that. So we're just going 1 to 2 and all the way there, and then going down to 8, 9, 10, 11, 12, and then moving back here all the way to right. And that's our direction. Okay. So let's see, record finding after confirming and diagnosed by the dentist. So we can record these findings. They have cavities, extractions, all of that. We can help explain that for the patient, and we can use any other magnification or software to enhance our work. And you can see here, digital, we can do a lot of different things to enhance the images, so we can have better view of the structures that we want to work with. So this just kind of shows you, like, for example, is image number 1 mounted correctly? Yeah, by itself. Like, is it backwards? Is it upside down? Yeah, it's correct, right? It looks like correct. We have mandible teeth here, two roots. We have the mandibular arch, going up and all of that. How about number 2? Upside down, right? Again, because you can see the mandible here. You can see the 2 roots. Let's take a look. And 4 and 3 also looks like this one looks right? Because we have 2 roots here. So this is the mandible, and this one looks upside down. Correct? Yeah. Anyway, we have a lot of, again, you just get used to it, and as you move forward, you start recognizing teeth and landmarks to do a better job with this. Any questions? So let me stop sharing here. Let me go there. Let me stop the recording.